Okay, so I think we're recording now. So this is going to be about the acidosis and alkalosis question that you had. So this comes from the renal 16 and 17 lecture that Dr. Cheng gave. And his slides are pretty complicated. I don't think it needs to be that complicated. When you study this, I would focus on just understanding the basics. So I'll try to cover that right now. So this is the diagram from first aid. So let's start with what's normal. So normally your blood has a pH of 7.4. Okay. So if your blood gets too acidic, meaning that the hydrogen ion concentration gets too high, okay, and your pH drops below 7.35, that's considered acidemia. Now, if your hydrogen ion concentration gets too low and your blood becomes more basic and the pH is more than 7.45, that's considered alkalemia. Okay? So to understand this, you need to know that the more bicarbonate your blood has, the more basic your blood will be, okay? Or the more alkalemic it will be. The more CO2 or hydrogen your blood has, the more acidic it will be. So there's 4 categories, of problems associated with this. You're going to have respiratory acidosis, which is going to be an increase of CO2 greater than 44, okay? So normally it is 40, okay? So if you have an increase of CO2 in your body more than 44, that's considered respiratory acidosis, okay? So this basically means your body has too much CO2 and therefore it will be more acidic. Okay, your body can also lose bicarbonate. So usually your bicarbonate level should be 24. So if it's below 20, okay, that is also going to cause acidemia in your body or your blood to be too acidic. This is referred to as metabolic acidosis. Okay? Now let's say you don't have enough CO2 in your body. So if you are losing too much CO2, okay, you're not going to have enough acidity to your blood, okay? Your blood's going to be too basic or too alkalemic, okay? And this is called respiratory alkalosis, okay? Now let's say for some reason your body has too much bicarbonate, okay? Or the ratio of bicarbonate to CO2 is too high, okay? So usually bicarbonate is 24, so if it's greater than 28, then that's going to be considered metabolic alkalosis, okay? And I know that was, a pretty basic explanation and probably too easy for you, but it's really important to understand that to understand the rest here. So let's look at this diagram, okay? So this line right here is going to represent the pressure or concentration of CO2 in your body, however you want to look at it, okay? This is the buffer line. It's not as important. But right here at this point is normal. Your pH is 7.4, which is normal. Your plasma bicarbonate is 24, which is normal, okay? And then this line right here means that your partial pressure of CO2 is equal to 40. And so if this line gets moved this way, then the partial pressure of CO2 in your body is increasing. So right here might mean that it's 50, right here might mean that it's 60, right here might mean that it's 70, and then below this line means that the CO2 is decreasing. So right here might mean 30, 20, 10, and so forth. Okay, so let's start with this. I think that's pink. I'm colorblind, so I can't really tell. So let's start with this, pink or gray or something. So what happens with respiratory acidosis? So this happens in hypoventilation, any disorder or disease where you're not getting rid of enough air. Okay, so if you're not exhaling enough, if you're not breathing enough, if you're breathing slow, if you have an airway obstruction, okay, so you can't breathe out. If you have a chronic lung disease such as COPD and you can't exhale all your air, okay, then you're going to have a buildup of CO2 gas in your blood. Okay, so like I said, the CO2 pressure in your body is going to increase. Okay, so your body's now going to be at this point. Okay, and the buffers in your blood can compensate a little bit, so the bicarbonate will increase just a little bit. Okay, so that's the primary disorder. Now your body is too acidic, the pH is too low, and it doesn't like that, so it needs to compensate for that. So there's going to be some acute compensation by your kidneys, but usually your kidneys don't start to compensate until after, I can't remember what the number is, maybe 6 hours. So after 6 hours, your kidneys recognize that your body is too acidic, you have too much CO2, and it's going to compensate for that. So if your pH is too low, then to raise the pH, your body is going to start creating more bicarbonate. Okay? So your body can create more bicarbonate in two ways. Let's see if I can find this in the lecture slides. Anyways, I can talk about this later, but essentially your body creates more bicarbonate. Now it creates more bicarbonate by not reabsorbing as much bicarbonate, by reabsorbing more bicarbonate in the proximal tubule, and then also by secreting hydrogen and ammonium. Okay, so as your body creates more bicarbonate, this point is going to rise. So this is going to be partially compensated respiratory acidosis. So if there's a point right here on this graph, and this might be a question on the test, a point's right there, recognize what it is. Know that because it's above this 40, it's going to be respiratory acidosis, and because it's above the buffer line, so your blood's normal buffering capability, it means that there's some type of compensation. Now, if you look on the y-axis, okay, this is your plasma bicarbonate concentration. So if the point's right here, that means that your blood has more bicarbonate than it usually does. And this is because your kidney is reabsorbing and creating more bicarbonate than it usually does. Essentially, the more bicarbonate you have, the higher the pH you will have, okay, because your body wants to return that pH to 7.4. So with respiratory acidosis, the point starts right here. Once your kidney starts compensating, it starts moving right here, okay? So higher bicarbonate, higher pH. And then after a while, if you have a chronic airway obstruction or lung disease and your kidneys work well, it can actually compensate fully. So with people that have respiratory acidosis and a full compensation, their pH is going to be back to normal. They're going to have a really high bicarbonate level, okay? And they're going to have a really high CO2. Okay? So that's going to be respiratory acidosis with compensation.